jump in a bit, but good afternoon, ladies and gentlemen. Thank you very much for joining us today on episode 9 of the Fleri Care Digest. Today, we have the pleasure of spending time with Dr. Ebi Ofrey, and I was just saying, one of the stalwarts of the Nigerian health tech ecosystem. Um, you have done a lot of work that has made companies like Fleri possible. Dr. Ofrey, welcome to the Fleri Care Digest. Thank you for honoring us with your presence, and thank you for giving us the opportunity to get to know you. Introduce yourself to the folks watching. Introduce yourself to the audience.
So thank you very much, Sam. As you have said, my name is Dr. Ebi Ofrey, and I'm currently the co-founder and CEO of GeroCare. And it's indeed a pleasure to be here this evening, talking about the great work we're doing in Africa.
Great. So since you started off like that, um, let's not start with the great work you're doing, but let's start with the great person who is doing the great work. You are not just an MD, but an MBA, business minded, focused on healthcare, has been working tirelessly to ensure that a segment of our healthcare ecosystem that gets often ignored, elderly care, geriatric care, going on palliative care, assisted living, things that everywhere else in the world, every economy is focused on and worried about because of the significant burden that it creates when you don't handle it well. You've been focused on this years before people realize this. Tell me a little bit about how you got started, how you got into geriatric care, and most importantly, how you ended up founding GeroCare.
All right. So interestingly, I've been a doctor now for just over 2 decades. I think this is my 21st year as a medical doctor. But I started my career as a medical officer in a teaching hospital here in Nigeria, in a state called Bayelsa State, in a university called Niger Delta University Teaching Hospital. So I jumped around in various departments and ended up in the family medicine department, where I rose to become the chief resident. At that point in time, I realized, fortunately, that I did not want to remain in residency and had the opportunity to have a scholarship to go and do my PhD, a master's out of the country. Interestingly, I received a lot of offers for masters in public health, masters in medical related things. But at that point in time, I knew business was where I wanted to be. So finally, I got a scholarship in an MBA in Malaysia, in UCSI University, and had the opportunity to go there about 13, 12 years ago, where I also double trained in Blue Ocean Strategy. When I got back, I was now made the medical director of a state hospital in Nigeria, spent a bit of time there, then moved to the Bayelsa Health Insurance Scheme, where I was head of medical services for about 2 years before I left to build and grow GeroCare. And interestingly, the transition was not because I had uh, a need to go into entrepreneurship. It was because really I had a personal experience that made me understand that nobody was doing this. And so I needed to take the plunge and solve this problem. So in that period of time, what actually prompted all this was the fact that in just the space of 1 year, my father had two massive strokes. And really, as I mentioned, I've been a doctor for a while. It's not because there's nothing I could have done. I was simply living and working far away from where he was. So subsequently, like only a mother could do, my mom called me, told me her blood pressure was high, her blood sugar was high. But that was not the main thing. She said something that can be said to be the genesis of GeroCare. She said I had neglected her and neglected my father. And initially, I thought that was impossible. That doesn't make any sense. But after closely analyzing my life, I realized that while focused on my business and my career, I had subconsciously neglected them. We also realized that this problem was not peculiar to me, but to millions of Nigerians and Africans living and working far away from where their parents are. And the only time they hear anything most times is when something goes tragically wrong. And so the question was, is there a way whereby no matter where we are in the world, we can provide healthcare needs of our parents? And not just that, remind them that we care. And so my co-founders and I took it upon ourselves to solve this problem. When we delved into it, we realized that in Nigeria, for instance, before you get to the age of 40, or by the time you're at the age of 40, there's a 75% chance you will have lost one or both your parents to untimely death, or if not, have them severely incapacitated, all from conditions that could have been prevented. And this, we found it unacceptable. We decided something had to be done, and then we gave rise to building and growing GeroCare the way it is. So initially, I had no interest in geriatrics, but then I understood, there was a problem that needed to be solved, and nobody was doing it. So we should take the plunge and solve that problem.
Doc, I really appreciate the background that you shared with us. And, over and over again, the conviction that comes from people who've experienced issues before and looking around is like, okay, someone else should be solving this, someone should be solving this. And then at some point in time, you realize that, well, I am someone and I can solve this in that way. I want to be able to connect the work that you started and are doing, right, to the other part of what you're known for, advisory, support to early businesses, and you touched on it, this mastery of blue ocean strategy. Now, while I understand that your own family circumstances, your mom, your dad played a really significant role in getting you here, I also want to understand how your mindset around blue ocean strategy and doing what no one else is doing or going left when everybody is going right has played a role in the way that you perceive geriatrics, right? The way that you perceive elderly care. What is it that you've seen there that nobody else seems to have seen? And it's only recently that we're starting to see some people pick up, on that end. But how do you marry the two, and what's the connection?
Okay. So interestingly, I always knew I would, when I got back to Nigeria from my MBA, I had been bitten by the bug of business. After spending 1.5 years hearing all those things, even when you get back, though you're a professional, you want to do something. And every person I met always mentioned things like, but you're a doctor. Why don't you do something in medicine? And then I realized applying what I had learned from Blue Ocean might also be a key to ensuring I can do what I need to do and differentiate myself. If you know anything about Blue Ocean, you know that it basically revolves around what they call creating uncontested markets and making the competition irrelevant. So it's basically stepping out of the mold and ensuring where you go into, nobody else is there. That's the idea of the blue ocean and the red ocean bit. The red ocean is where other people currently exist. The blue ocean is the bigger part of the ocean where nobody else exists. So having that in mind and applying the tools and strategies, I was able to convert a basically orthodox business system to a more innovative one. So what I tell people, especially in my Blue Ocean trainings, is that Blue Ocean allows you to convert any business model, service, or product from ordinary to innovative in 6 steps guaranteed. And I was able to say so because in my master's, I actually applied Blue Ocean to a t-shirt and came up with a more innovative t-shirt. So I knew it could be applied to anything. So I basically used the knowledge of Blue Ocean, the key of which is what they call the ERRC grade. I won't get too deep into it, which is eliminating some things, reducing some things, raising some things, and creating some things. So yes, I knew I wanted to go into something, and the only thing I could have done was create a normal hospital like everybody else. But applying the tools of Blue Ocean helped me understand what are the things people take for granted in the industry that don't need to be done. What are the things I can eliminate? What are the things that can reduce, especially because of technology? What are the things that can raise? What are the things that can create? So I realized I could eliminate totally the hospital structure, the infrastructure needed, because we realized that many times when you go to a hospital, the only person you really see is a doctor. You don't need to see the lab scientist, you don't need to see the pharmacist. And so the question was, do you even have to be in the same building with them? So what we did was convert the patient's home to a primary healthcare center where the doctor arrives connected to everybody else you need. So like a typical consultation, he sees you, but instead of writing a prescription, he makes a medical request and then it's delivered to you at home. Same for lab investigations. And so we're able to eliminate the total need for a building and make your home the hospital for the doctor. What were we able to reduce? The price, issues. So we leveraged on a subscription plan, which basically makes payments more flexible. What were we able to raise? Customer satisfaction, customer attention. What were we able to create? A structure for home care. Because prior to us, there was no real structure for home care. Maybe you have a friend that is a doctor that goes to your house, or maybe your uncle has somebody he knows, but there was no real structure for organized home care services. And then we put that in place. So all these things were as a result of the Blue Ocean training, enabling me to think out of the box and ask questions ordinarily I would have been asking myself to help me come on to different answers. So that's the abridged version of how the Blue Ocean applies to what we do.
I really, really appreciate that. And I really wanted to ask that question knowing we'll be together today, because a lot of the time we tend to focus on the fact that, yes, folks like yourself, folks like myself, are motivated by tragic circumstances, incidents that have happened in our past, experiences that we've had. And in fact, that's not unique, right? Almost everyone in the diaspora, like you said, is data backed, has an experience with either a relative that was, misdiagnosed, given the wrong medicine, died waiting for care, had an accident and was not responded to, lack of emergency services, money that was sent and misappropriated. I mean, the list for why people end up dying in our communities is just endless. You could literally do, a movie, 1,000 Ways to Die in Africa, and that list will have to be more than 1,000, right? But there's also the key part that we tend to miss. In the midst of all of the chaos, in the midst of all of the complaints, in the midst of all of the challenges, is a massive opportunity that exists to be able to solve problems, right? And it's important for people to be able to understand that people like yourself are not just motivated by the doing good, but also you're motivated by the doing good business.
Yeah.
Right? And that's pretty critical for us to be able to emphasize. So you started GeroCare. We know the problems that have led to it. We know the circumstances. How is GeroCare positioned today in Nigeria, right? With all of the things that exist, how is GeroCare achieving or going after the mission that is set out to do? What do you do for the folks in the diaspora that are watching this today? What do you do at GeroCare? How do you help people's families, right? Tell us more about that.
Okay. So I'll talk about that from two directions. One is the firm belief that when you choose GeroCare, you are not just choosing a healthcare provider, you are choosing a family member in Nigeria. And so, whatever your actual family member would do, GeroCare would do something similar, if not more. What we see it as is when somebody subscribes to our service, the picture we have in our minds is this person has held the mother or held the father by the hand and brought them to GeroCare to take care of in their absence. And we all know the amount of trust that is needed to have that done. I remember when I was growing up, if your parents want to travel, they take you to your neighbor's house to take care of them. Many times, these neighbors will even spend more attention on you because it's a bigger responsibility than even their children that are with them. Because if not, something happens to you, they cannot really explain to your parents. So it's very similar to what we do. When somebody signs up on our platform, the person has been seen to hold the parents by the hand and brought them to us saying, look, we are not around. We would like you to provide all the care we would have provided if we were here. That's how we see it, and that's how we approach everything. So many times you hear patients say we've done above and beyond even what their child will have done if it was here because of the responsibility we understand. So that's the one part of things. The second part is more like the technical aspect of things. So what happens is GeroCare makes it extremely easy for Nigerians wherever they are in the world to subscribe for regular doctor home visits and home medical care for their parents in any city in Nigeria in 3 simple steps using the GeroCare mobile application, or probably now going through Fleri and passing through that process. So what happens is that they basically just create an account for themselves as the sponsors, add the details of the parents, and make a payment. Immediately, the parents are matched to a doctor who lives nearby. Fortunately, we have over 700 doctors on our platform across Nigeria, so there's really nowhere they will be that we can't get to. What then happens is the doctor calls the parents to schedule his first appointment. And then when he gets there, he enables you, the child, to follow the care real time from wherever you are. So when the doctor gets to the house, he checks in on his application. Wherever you are in London, Paris, in New York, or even another state in Nigeria, once he checks in, you know the doctor is in your house. When he's done, he checks out, you know he has left. You then receive a summary on how they are doing for that day in a language you can understand. You would not need to take it to another medical practitioner to understand what they're saying. Why that is important is because no matter how much mama tries to explain to you what was done, it can never be the same as the doctor telling you directly what happened. So you get a report on what happened. You now see the recommendations, the drugs and tests. If you want us to provide that, you make a payment for it and it's delivered to them at home. So they get the entire experience of a hospital, but in the comfort of their home, with the added benefit of you following whatever is going throughout the process. It's also important to point out that the care is not a substandard care. It's the same care they will have received if they go to a hospital. And the beauty again is that the care is not one-off. It's actually a monthly visit to ensure we catch any conditions at the earliest possible stage and bring the patient back to normal to prevent any unforeseen emergencies.
Yeah.
And why that is crucial is because many times the infrastructure necessary to care for them is not available. And so the key is to prevent them from getting to that point. Many times people say, but my father is well, he's strong, I don't need general care yet. What I tell people is that the fact that they're strong and healthy is the most perfect time to subscribe. I usually tell the story of a family friend, his father, who on a Sunday morning went to preach in church. After service, he decided to call his friend on the phone. While speaking to his friend, the friend could not hear him. And so the friend thought it was network and kept on dialing. But the guy had passed away. And you will say, but I saw this guy this morning. He was strong, he was healthy. But the question is, was he strong or was nobody just monitoring? Because when his blood pressure moved gradually, nobody was there. He hits a critical level and he passes away, and you say, but what happened? The question is, why are you checking? And so if you subscribe when they're fully healthy and we go there and there's nothing, good, we can ensure they remain that way. If you go there and meet something, also good, we cut it on time. And so that's what we ensure we do to allow our parents live a longer, healthier lives. Because the problem is that when they were doing all these things for us, we were happy with them, everything was going fine. But at the point whereby they should enjoy all the benefits, all this tragic thing happens. But there's a simple solution, which is what GeroCare can do to ensure they live a long, healthy life and can play with their grandchildren and also be reminded that wherever you are, they've not been forgotten. You are still thinking about them. And that's why a doctor comes to see them regularly at home.
Usually I'm the one who is telling people about, all of this, why this is so important. Usually I'm the one who is busy preaching, and it's really interesting to be able to hear the problems are not new,
Yeah.
right? The problems are not new, and in reality, they're the same problems that our uncles and our aunties who moved to the US 10 years ago, 20 years ago, um, they're exactly the same,
Exactly.
right? All we've done is inherit, right, the same challenges, and we're using the same tools, right, money transfer, to solve the problems that in reality we should be smarter to solve today. But thank you very much for breaking down, what some of us knew but needed the world to know about GeroCare. We've spoken about the actual work, right? We've spoken about the reasons behind it. What are the outcomes that we want to get? And I'll touch on a couple of things. In the last 10 years, we've seen um, non communicable diseases rise in the share of uh, actual disease burden. A lot of the work that has to be done will have to be done on the primary care side and on the preventative care side, right? For GeroCare, you're doing both, geared towards elderly parents, right? What are the outcomes that you want to achieve, both tangibly, right, but also the ones where we can't really measure, like peace of mind, like things like, just to be able to see people have the opportunity to do the things that bad health prevents them from doing, even the cynical ones, right? Like seeing your grandfather or your dad breaking it down at a party, just dancing, and he becomes the next meme on social media. Sometimes we look at those videos and then you're like, everything else aside, you pray and hope that your father is able to get to that age and do that so someone takes a picture of them, right? But tell me about the outcomes that you think about, the metrics that move you, what you talk to your team about, what you're optimizing for.
All right. So I'll take it from another direction
Hmm.
and talk about the outcome I would have loved to have in my life
Yeah.
that I don't have and I'm not experiencing, that I don't want other people to go through. So
Hmm.
basically, the pleasurable outcome is the opposite of what I'm experiencing. So for anyone who knows my father, they will know he was one of the most larger than life people. But anytime I get home today, I'm reminded of why I do what I do. Because many times people don't understand why you are so forward, why you are
Yeah.
so aggressive.
Yeah.
And so I liken it to when you take your child to the hospital. Most of the time, you hold his legs down, you force him to take injections.
Yeah.
The child is wondering, what is wrong with this man? What's all this hula baloo? Why do I have to go through this?
Yeah.
You have to go through it because the father understands what can happen if he
Hmm.
doesn't force you to do that. So
Yes.
many times people say you are passionate, you are great. No, I understand clearly because each time I go back home, I see what could be the repercussion of me not taking the action I need to take. And it's because I understand what will happen. I need to make sure you see it and try and prevent that thing from happening. So the main outcome we are working towards is ensuring people, families or fathers and mothers are able to live longer, healthier lives, are able to experience their grandchildren, but experience their grandchildren without feeling like a burden to the children. Many times our parents, or most times our parents have what they call a selfless love for us.
Yeah.
And many of the time they'll be going through different things you will have no idea about, but they will not tell you until it's late.
Yeah.
With companies like GeroCare, you are able to preempt all these things. Like I remember my mother, for instance, is hypertensive and diabetic, and she's a pensioner. So at the end of the month, she needs to decide from a meager pension what medication to focus on. But she has 3 children who can take care of all these things. But she does not want to feel like a burden to them. So with GeroCare, most of the time, before her drugs are finished, we know about it and have replaced the medication. And so she doesn't feel like a burden, but has the kind of life she wants to have. Understanding that, wherever you are, you still care for her. So the main goal is to ensure our parents live a longer, healthier life, to ensure they're able to, understand that they've not been neglected. Because Sam traveled to the US does not mean he doesn't care for her. It just means he needs to fend better for her and had to step away. Understanding that the second best thing is available to care for her, which is GeroCare. So that is the total picture, and allowing Sam in the US have peace of mind, knowing fully well that GeroCare will do above and beyond what he could have done. I
Yeah.
remember once when my father was ill, I didn't even try and go to Bayelsa State because I knew his GeroCare doctor was there. What additional thing will I do physically that doctor will not do for him over there? So
Yeah.
I could have the peace of mind to stay where I am. So two things: peace of mind for the people outside there, that their parents are being taken care of, being able to track their expenses, being able to be sure the money is used for what it's supposed to be used for. And for the parents over here to be able to live a longer, healthier life and be able to spend time with their grandchildren in the later years after spending the mass of the time caring for the children. They can now relax in health and participate in the jokes and the joyful moments of having successful children and grandchildren.
Yeah, you've touched on a lot, Doc. You touched on a lot that comes out often. Um, Yesterday or 2 days ago during the launch event in DC, I was listening to a gentleman who's also Nigerian. I'd never met him before. And as he spoke, Gigi, he talked about his own experiences, right, with family members back home and the struggle, when he moved here, just picking up the phone and trying to get someone to go see his mother, right? Um, I think sometimes we overestimate like just because someone is back home or even living in the village doesn't mean they have nothing to do or they're just there, right?
Mhm.
And so you start calling and you're like, Auntie, can you go see Mama at home? I heard she's not feeling well. When I called Mama, I don't know what the problem is. I sent her money last week. I hope that she's okay. But then she didn't really sound well. I don't know. I'll see. Maybe week today I'll go there because I have things to do. I have to go to the market. We have some things to get. Um, and you start to realize that, like, just because people are family doesn't mean they're just sitting there with nothing to do, just waiting for your instructions left and right. Right. And there's so many other things, our societies, there's so many other things that come in, right? Maybe you haven't sent Auntie money in maybe 6 months, right? She's not going to tell you, but you haven't done the proper thing. You should know by now if you're going to ask Auntie to go do something, you should have said transport money, right? But a doctor is not going to ask you that. GeroCare is not asking you, hey, this is what we needed. Why haven't you called us? GeroCare is there to do the work that they have set out to do. I think that's why it's sometimes very important. I tend to see this a lot in even more educated diaspora, right? Especially, they like to tell you how much my cousin is a doctor,
Exactly.
right? My sister's brother is a doctor.
Mhm.
Um, my classmate from school is a doctor. And they throw that word around without thinking about, well, is he a geriatric doctor? He might be a pediatrician. What is he doing with your parents?
I even think you're taking it a bit far in the sense that, yes, he's a doctor, but the only time he comes in is when something tragic has already happened.
Yeah,
So yes, he can be anything, but he's a doctor. He will get there. But the key is that we don't want her passing through that turmoil before there is a reason to call the doctor. And then you can't tell your friend that is a doctor, check on her every month just in case
Yes.
something happens. So yes, you have friends that are doctors, but what we do is ensuring they don't get to the point where you need to call that friend. Because as you mentioned, the friend has things he's doing.
Yeah.
It's not as urgent to him as it is to you.
Yeah.
So most of the time, we've noticed that the sponsor, for instance, the person in diaspora, mama has a headache, really here, just a slight headache. But
Mm.
when the sponsor in the US hears it, in his mind, he's hearing a migraine that's about to lead to stroke.
Yeah.
So when he's passing the message to the person over here, he has that apprehension.
Mm.
Maybe the first time the person will pick up on your apprehension and go. He now goes there and sees mama is laughing with him. He now says, why was this guy worrying my life?
Yeah.
The next time he goes, by the third time, he will not pay that much attention anymore because you are just an alarmist.
Yeah.
So what GeroCare does is see them regularly. So I consider it like monthly ward rounds. So in a hospital, a doctor does a ward round whether the patient is ill or not, just to make sure everything is in order and give you a feedback. So at the end of the month, when you get your report, you know, okay, this month has gone by, everything is fine.
Yeah.
So the idea is not to let them get to where you need to call a doctor. Because even when he gets to that point, most of the time he calls the doctor and he gets there and has to move them to a hospital, another gamut of issues are already taking place. But
Yes.
if he's seeing them regularly, the condition he meets can be managed in the house and you don't need to go that far.
Yeah.
So that is just the essence. Yes, you have your friend that is a doctor. We even have people that say, my brother is a doctor. Yes, he's a doctor, but does he check out every single month? Does
Mm.
he give you a report on what's going on? So if your brother is a doctor, perfect, because the GeroCare report can give him a clearer picture
Mm-hmm.
of what
Mm-hmm.
is going on with them regularly.
You know, you couldn't have said it more perfectly on this, and I think that's really where it comes in. I want us to talk about the actual products from GeroCare, right? So, obviously, for those of you who are watching, um, Dr. Ebi Ofrey is a very talented, experienced doctor who not only practices but has also built GeroCare, which is the premier, geriatric care provider in Nigeria. Technology led, but very patient focused. And I think that's one part that when I was in Nigeria speaking to you, last year we talked about it. The balance of software technology, but also human intervention cannot be overplayed. Computers are not going to take care of our parents in Ghana. Robots are not going to take care of our parents in Ghana. Now I hear AI and ChatGPT every single week, but you know they won't fetch water for my mother.
Mm.
They won't take my dad to the hospital. They won't drive my dad to go get his injections. Right? People will, and I want you to talk about the various. Well, first of all, the approach to um, the product design at GeroCare. And then when you're done, we can dive into each of the plans and the categories, what pockets they fit, who should be thinking about it as we start pushing that to the diaspora to understand. If you had family back home, now you really don't need to worry about them in Nigeria, if that's what it is that you're worried about.
So the interesting thing about the way we designed the product was because I myself spent time actually seeing patients and understanding how the process works and what they need in place. So I spent about 2 years while I was still working in Bielsa State, actually running the service physically, offline. There was no tech involved in this. So a few people paid me monthly to go and see their parents at home and give them updates on what's going on. And the level of delight they got and the level of impact helped me understand that this thing should scale nationwide. And so no matter what we do, it's something I have done personally and understood the process fully, which is something that is a bit different in many other establishments, not because they don't want to do, but because they had never done it personally and understood everything about the process. Because one of the key examples I always give is that when I was seeing patients myself, we got to realize that you need to spend a minimum of 30 minutes with the elderly patients to get to the crux of the matter. Because many times they need to have spent that amount of time with you to be comfortable enough to be able to, for lack of a better phrase, spill the beans. Many times in hospitals, doctors are in a hurry, and so they don't get to the matter the patient has. Many times the patient is nervous and misses out on those things. And these are things I would never have realized if I wasn't doing it myself. And so towards the end of your visit, you're already stepping out of the house, is when mama remembers the main thing that was the problem. So all that is factored into it. Also, the fact that psychotherapy is key. You realize that in that 30 minutes, maybe 15 minutes is actual medical care, and the remaining time is just having an educated person to speak with. Because many of the times they are around maids and other people they can't have intellectual discussions with. So that fashioned how we organize the entire system to understand how the people work, how they need it, and understand the best way to provide it. So having said that, the key products are threefold. So mainly we have what they call the on-demand service, where you pay for a service only when you need. So it's within 24 hours of the payment services, provided. But that is not the encouraged pattern. As I mentioned earlier, on a subscription is better, whereby they're seen regularly. You can also decide the spacing between the visits. So it's either a visit a month or a visit a quarter. You can also decide what you want to attach to it. So through Fleri, you can fund your wallet system and let us be able to draw down for the medication whenever it's needed, or you are alerted when a medication is needed and you make a payment. Either way, we are able to ensure the entire process is smooth. So the key is the on-demand service, whereby you pay when you need, and then we have the subscription service, which may be monthly or bi-monthly or quarterly. Basically, depends on how you want it to be done. But as I mentioned earlier, the more frequent, the better, just to ensure things don't get out of hand before the next visit. Prices are available on the Fleri site, so any further details you have, I'm sure Fleri will provide them for you. But what I would like you to know is don't wait till something happens. Yes, they are strong and walking about now. This is the perfect time to start. Because for the elderly, once something happens, it's extremely difficult to get them back to optimal level. So why wait? Do it now. We have on demand for when something happens, but why wait for that? Do it now.
Yeah, so I wanted to touch on that because as people listening, and the video is going to go up, it's going to go on YouTube. We're going to be breaking those down, putting it into the platform in the product education series, but also we're going to be sharing that with our Nigerian communities here that we work with on that end. I'd love for you to talk about what do they expect once they purchase a plan, right? You previously touched on the fact, you go onto Fleri, go into your dashboard, go to the health exchange or find a care plan. It would allow you to be able to see all of the plans from GeroCare, right? But also it will break it down. But I want you to talk through that breakdown of the services that they expect to see on if it's a monthly basis. When a GeroCare doctor goes to see my mom, right, in Anambra, what is she expecting, once you show up?
Right. So the key thing is to liken it to an actual hospital visit. When you take your mom to a hospital, what does she experience? So let's walk you through the user journey of a hospital setting or a patient journey. The patient gets there, the nurse takes the patient's vital signs, the BP, the temperature, the breath rates, and everything else. Once that is done, the patient is in the waiting room. The patient is then transferred into the consulting room where the doctor sees the patient. In medicine, there's something we call history taking and examination. So there's first of all a conversation around what they came for, their symptom, when it started, where it moves to, and other things like that. The review of the systems. And then there is an examination, a physical examination of the patient. Once that is done, based on the information from the history and examination, the doctor arrives at a certain diagnosis or certain differential diagnosis. He may need investigations to hone down on the actual thing, but he can set you up with medication initially and then have you do a series of investigations, and then come back and give you the medication. So now, transfer the entire scene to your patient, your mom's home. So the doctor gets there, he has the consultation with her, the history taking, the examination, physical examination, examining all systems. He then takes the vitals exam and other things. He arrives at possible diagnosis or differential diagnosis. He makes a request for investigations or for prescription via the application that is delivered to mama at home. If mama needs tests, somebody is sent home to take the blood samples. If she needs radiological examination like x-rays, MRIs, GeroCare arranges pick up and drop off to ensure she's picked up, taken to the center, facilitated such that she doesn't pass through any stress, takes her back home, all while you are where you are taking care of the bills. So they basically have a VIP hospital experience in the house. So it's not a checkup. Some people say they do a checkup for them. We're not doing a checkup for them. We are taking them through the entire experience they would have received if they were in an actual clinic. So imagine a monthly hospital visit taking place at home for you, and then giving you the updates on what's going on. I think you're on mute, Sam.
I was saying I really appreciate that context, because a lot of the time, I meet so many Africans, and the challenge that sometimes we have is, well, if they go to the hospital and they go see my mom and there's nothing, did I not just throw money away? But I'm like, you pay for car insurance every month, and month after month, you don't crash your car. Do you feel like you're throwing money away? Right? Most people will say, no, I am not. Right? Well, if you crash your car is replaceable. If you lose your mom, you only have one of her. Would you much rather not know that your mom is doing well month on month and to keep doing what she is doing than to have her fall sick and feel like you're getting your money's worth from the care that she will get? I think that balance is constantly what we're going to continue to fight and see, from a cultural perspective in our mindset.
Let me add something here.
Yes.
So again, the real perspective is the eventual cost it will take.
Yeah.
So don't imagine this, I don't know how to phrase that. If someone has a stroke, the amount of financial drainage, emotional drainage, mental health issues that the person will have, compared to just spending a month to ensure those things never happen. So you go there and there's nothing, fine, it's prevented. But however, if you don't go and something like a stroke happens, her entire life is in turmoil. So in medicine, there's what they call the affected and the afflicted. The person that has the condition is the afflicted. Everybody else is the affected. So when a condition arises, it's not just mama that will go through it. Every single person around her, including you that is where you are, is affected by that condition and pass through turmoil and stress. Just sleepless nights thinking about what they are going through. So it's not just the money you spend when something happens, it's the added, issues that complications that take place, which could have just been avoided if she had gone regularly. For instance, if she goes there and there's nothing, they may just even cancel her on her diets or cancel her on what to do to remain the way she is. Because without that information, though she's fine today, tomorrow she may be worse simply because she was not given the information necessary. So
Yeah.
this is really why I'm extremely passionate about this. Because as I said in the beginning, I have seen firsthand what can happen, and I don't wish it upon my enemy. So the key is to ensure you do what's necessary to prevent all those things from taking place.
I really, really appreciate you spending that time going through, Doc. Wrapping up here, I want to give you a chance to be able to close out with a message to the diaspora. But for those of you who tuned in and for those of you who are watching this, um, GeroCare is changing the way we think about care for our parents, our elderly loved ones back home. They do what you wish you could do, but cannot do because of the 12,000 miles that is between you and your mom. We only have one set of parents, one set of grandparents. And for all of the love and care that they've shown us, we owe them an eternity of gratitude. But gratitude doesn't help climb stairs, neither does gratitude solve medical problems. Doctors do. GeroCare is a group of doctors that provide and show that gratitude with real healthcare. Dr. Ofrey, your last word.
Okay. So we would like you to have in mind that GeroCare is not just a healthcare provider. When you subscribe to GeroCare, you are actually gaining a family member in the sense that what a real physical family member would do is what GeroCare is going to do for them. So you can be rest assured that we go above and beyond to ensure these people are taken care of. So I don't want to sound too medical because yes, we do the medical thing, but the truth is that in our hearts we understand what we're doing is not just medical care, but connecting families back together. In Nigeria, for instance, when you want to find out how somebody is doing, or if you want to find out how somebody is, or if somebody cares, the
Yeah.
question they normally ask, especially for couples, is for instance, your girlfriend or your wife will say, Sam, have you eaten? Have you eaten has a lot of connotation there. It means I care whether you live or die. I care if you exist. So just sending a doctor to check up on them is equivalent to have you eaten. It means I care what happens to you. I care if you live or die. Especially for our mothers. I love you by mouth is not enough. You can say I love you as much as I want to, but the action they say speaks, is worth 1,000 words. Take the action to remind them that they have not been forgotten where they are. Understanding that GeroCare, the people you send, are not just healthcare providers, but will do everything you would do if you were there to do it yourself.
Yeah, it's been a pleasure having you here. I've been a big fan, admirer of the work that you're doing, and we're privileged at Fleri to be able to work with you and to continue to help people understand just how important the work that you're doing is. Thank you very much for showing up. Thank you very much for your time, Dr. Ofrey. It's been a pleasure having you on episode 9 of the Fleri Care Digest. Thank you. Stay safe. Appreciate it.
Thank you. It was great being here.